Hi, my name is Dr. Marshall Brinkley. I'm Director of the Hypertrophic Cardiomyopathy Program here at Vanderbilt University Medical Center. On behalf of the program, we would like to thank the Hypertrophic Cardiomyopathy Association for inviting us to join HCM Awareness Day. We have a few program updates I'd like to tell you about. First, we've seen growth in our program over the last year or two, which is exciting because it means that people with HCM have access to comprehensive care. Two, we have a great specialty pharmacist, Amanda Kibbins, who's been helping us prescribe and monitor mavacamten to make sure patients have access to that. Number three, as part of our effort to advance the field of HCM, we're participating in this clinical trial Sequoia for aficamten. Dr. Stevenson has an additional word about some research updates in just a moment. And we also have a few personnel changes recently here. Dr. Michael Baker, the Director of Adult Echocardiography, is helping to ensure optimal imaging quality and interpretation for our echocardiogram studies. Dr. Kashish Goyal in Interventional Cardiology is specializing in structural heart disease, including alcohol septal ablation, and he'll introduce himself in just a moment. And Becky King, our clinical nurse navigator, has joined us in the clinic.
I'm Lynn Warner-Stevenson, the co-director of the Hypertrophic Cardiomyopathy program here. I was in Boston for much of my career, but I came to Nashville because of all the exciting opportunities here, in part with this program. This is an exciting time to care for patients with hypertrophic cardiomyopathy. The HCMA has made a profound impact on this field by raising awareness among patients and their primary physicians who now realize the importance of specialized HCM care. We're seeing more patients every week. It's a privilege and a joy to take care of you and your families because there's now so much to offer. The availability of mavacamten has excited our patients, now with access also to aficamten for investigation. With such benefit for symptoms and quality of life as well as for heart function, we are a little disappointed that we still face considerable problems with reimbursement for these breakthrough drugs. We see many patients who bring a diagnosis of hypertrophic cardiomyopathy, but in fact need treatment for other serious heart diseases that have not been recognized. These are sometimes structural diseases of heart valves or congenital heart disease. Our surgeons are experts with outstanding success with the septal reduction surgery, but also with the complex mitral valve, aortic valve, and other reconstructions. We're also world-renowned for our cardiac genetic program, now performing all the genetic tests here on site in the Vanderbilt laboratory with results that are faster and more private. Many patients come to us with complex genetic profiles that turn out not to be hypertrophic cardiomyopathy or to be hypertrophic cardiomyopathy modified by other inherited heart conditions. Vanderbilt is at the leading edge of genetic analysis for cardiac disease in populations and for families with rare cardiac diseases. We look forward to learning about how we can help you or members of your family.
My name is Kashish Goyal. I'm a structural and interventional cardiologist at Vanderbilt University Medical Center. I trained in cardiology, interventional cardiology, and structural cardiology at Mayo Clinic in Rochester, Minnesota, which is one of the largest hypertrophic cardiomyopathy programs in the country. And one of my mentors, Dr. Rick Nishimura, was a prior chair of the guidelines as well. I have been involved in the HCM program since joining Vanderbilt at 2018. I particularly perform hemodynamic heart catheterizations to see if patients are symptomatic despite medical therapy from their HCM, and also perform septal ablation, which is a treatment for hypertrophic cardiomyopathy in a less invasive form as compared to septal myectomy. In addition to this, I also perform PCI, which is opening blockages in the heart arteries, and valve procedures for valvular heart disease.
Hi, I'm Becky King. I'm the nurse navigator for Vanderbilt's Hypertrophic Cardiomyopathy Clinic. I have been in a nursing field for 20 years, more recently in Vanderbilt in the HCM clinic, where it's very interesting. I learn something every single day. My role here is to help with coordination of appointments, testing, follow-up, making sure the patients have everything they need.
Finally, we'd like to join the HCMA in encouraging everyone to get informed about HCM and to encourage family members to get screened.